So carpal tunnel syndrome is a common condition that causes pain, numbness and tingling in hand, wrist. It occurs when the median nerve, which runs in this forearm in the volar aspect, is compressed or squeezed as it travels through wrist at the carpal tunnel. Here is a carpal tunnel. Now, some common causes of carpal tunnel syndrome include repetitive hand and wrist movements, right? Such as involved in typing, playing any musical instruments, using vibrating tools for mechanical jobs. Other risk factors for developing carpal tunnel syndrome like pregnancy, obesity, certain medical conditions such as diabetes, rheumatoid arthritis, or wrist fractures or dislocations. Symptoms of carpal tunnel syndrome may include developing tingling and numbness. Tingling and numbness in the lateral three. This is outer side or this is inner side. This is lateral three fingers may become the index, the thumb and the ring finger at times also becomes discomfort, tingling, numbness, weakness in the hand, making it difficult to grasp the objects, particularly the small objects, and doing the fine skills requiring the motor skills, the sensation of swelling or the fullness in the fingers and hands even when there is no visible swelling in the hand. If you suspect that you may have a carpal tunnel syndrome, it is important to see a doctor, particularly an orthopedic surgeon or neurophysician. The treatment options may include resting the hand and wrist in a cock-up position, wearing a wrist brace, or we call it wrist forearm orthosis, receiving of corticosteroid injections, or taking non-steroidal anti-inflammatory medications. This particular condition bothers you in night much more. Use night sprint so that keeping this position will definitely improve your symptoms. How to diagnose carpal tunnel syndrome? Typically, the diagnosis is made by physical examination of the hand and wrist, as well as imaging tests. The X-rays may be required, MRI may be required, and the most importantly, the nerve conduction studies, which your neurology colleague will help you to get it done. That is very important. So in addition to the treatment options and I mentioned just now, the other self-care measures that may alleviate the symptoms of carpal tunnel syndrome, which include taking frequent breaks from the activities that involve repetitive hand and wrist movements, such as typing or playing video games, doing hand and wrist exercises to improve the strength and flexibility, applying heat or cold to the affected hand or to reduce the pain and inflammation, using ergonomic tools such as keyboards, mouse. Nowadays all this Apple mouse is coming relatively more fat rather than classical mouse shape, maintaining good posture and wrist positions during the activities that involve the hand and the wrist movements. Prevention of carpal tunnel syndrome involves reducing the risk factors associated with the conditions associated with it. These includes maintaining a healthy weight, taking breaks during repetitive tasks, using ergonomic tools, and proper posture to reduce the strain on the hand and wrist. While carpal tunnel syndrome is a common condition, it is treatable, and most people with the condition are able to manage their symptoms with self-care measures and medical treatment. Certainly, here are some additional facts about carpal tunnel syndrome. The carpal tunnel syndrome affects an estimated 4 to 10% of the population. Women are 3 times more common than men to develop carpal tunnel syndrome, and it is most common in people aged between 30 to 60 years of age. People who work in jobs that involves the repetitive hand and wrist movements, such as assembly line workers, computer programmers, musicians, are at increased risk of developing carpal tunnel syndrome. In some cases, the carpal tunnel syndrome may be caused by an underlying medical condition such as hypothyroidism or diabetes. If left untreated, the carpal tunnel syndrome can lead to permanent nerve damage and weakness of the hand and wrist function. It is important to seek medical attention if you experience some symptoms of carpal tunnel syndrome. And the early diagnosis and treatment can help you to prevent further damage and improve your chances of successful recovery. In some cases, the lifestyle changes and the self-care measures may be enough to alleviate the symptoms. But in more severe cases, the medical treatment or the surgery may also be necessary to relieve the pressure on the median nerve. So the symptoms of carpal tunnel syndrome can worsen over time, especially if the underlying cause of the condition is not addressed well. Therefore, it is important to seek the medical attention if you experience symptoms such as numbness or tingling in your fingers, particularly on the volar aspect, particularly if these symptoms are persistent or worsen over a period of time. Certain factors can increase the risk factors of developing carpal tunnel syndrome, which includes genetics, repetitive and the hand and wrist movements, and underlying medical conditions as I discussed earlier. However, in some cases, the cause of carpal tunnel syndrome may still remain idiopathic or unknown. So there are different treatment options available for carpal tunnel syndrome, which includes the lifestyle modification, medications, splinting. The best treatment option for you will depend on the severity of your symptoms as well as the underlying cause of your condition. In some cases, alternative therapies such as acupressure, massage therapy, or chiropractors here may also be helpful in managing the symptoms of carpal tunnel syndrome. However, it is important to discuss these treatments with your healthcare professional, mostly orthopedic surgeons and concerned neurophysicians are well equipped to manage these problems in terms of their experience and qualifications. Simple exercises, stretches can help improve flexibility and strengthen in the hands and the wrist, which may reduce the risk of developing carpal tunnel syndrome. These exercises can also be helpful for managing the symptoms in those who already have this particular condition. And if you have carpal tunnel syndrome, it is important to take steps to prevent further damage to the median nerve. This may include avoiding activities that exacerbate your symptoms, using ergonomic tools, or modify your work environment, and seeking treatment as soon as you are noticing it. Symptoms of these conditions, as I have discussed already, are tingling and numbness in the hand. It may be unilateral, it may be bilateral as well. So here are some precautions I'm discussing. How to prevent carpal tunnel syndrome. Maintain a good posture. Sit with your flat feet on the floor and keep the shoulders relaxed, your wrists straight when using a computer or on other devices. Take frequent breaks. Take short breaks every hour so as to stretch your hand and wrist and to rest your eyes. Use ergonomic equipments, a keyboard, a mouse, or the other equipments that are designed to reduce the strain on your hand and wrist. Stretch your hands and wrist Do simple stretching exercises for your hand and wrist regularly to keep them flexible and more stronger. Avoid repetitive motions. Try to avoid doing the same motion over and over again and again for long periods of time, such as typing, using mouse for extended period of time. Prefer to use those trackpads which are nowadays available in Apple laptops. Keep your hands warm. Cold hand and fingers will exacerbate the symptoms of carpal tunnel syndrome, and keep your hands warm in cold environment. Use your gloves and all. Manage any underlying conditions. As I said just now, keep your blood sugar under control. Diabetes may be one of the factors. Rheumatoid arthritis can increase the risk of developing carpal tunnel syndrome. So it's important to manage these conditions as best as possible. If you experience symptoms of carpal tunnel syndrome, such as pain and numbness or tingling in your hands or the wrist, you should see a healthcare provider. As per your insurance, it must have been mentioned which orthopedic surgeon you can consult or which general practitioner in your area you can consult. But you need to seek medical attention in any of such symptomatology. And I think as an educated individual, after watching this video, can definitely what all one can do at his or her own levels. This video will be definitely helping you a lot in improvising your own self-care. Thank you very much. Bye-bye. Take care. Thank you. Make sure that you are subscribing Loke Talks. Hit on the like button and don't forget to hit on the bell icon. Thank you very much. Bye-bye. Take care.